I don't like a brush, and Drew may want to talk about this for a second, but it seems to me like coming at a dog or a cat with a brush is very intimidating. And most of the time when they start to we talked about doing this through puppy and kittenhood early on, that most of the time when you do that, you'll turn the animal off, and that procedure will become a negative experience that I now have to turn to my friend Drew and say, hey, help me on this animal because we got to make this okay. You can use brushes, and there are little finger brushes, there are regular toothbrushes, but I love using your finger, and I love using the gauze. One, because you can monitor the pressure, and two, the gauze is slightly abrasive. And three, using the CET paste, let's say, or the baking soda will take this off. Welcome everybody to this edition of Pause, Reflect, and Heal. I'm here with my good friend and co-host, Mr. Mark Drucker. And with us, we also have our great friend, Drew Webster, who, as you guys probably know, because you've, of course, listened to the first two sessions of this, is a certified dog behavioral consultant, certified professional dog trainer. He's been training dogs since 2009. He's an adjunct professor at the University of Denver, where he teaches Graduate School of Social Work. His passion is helping people who love their dogs and grow with them. You can find Drew at behaviorofdogs.com. Drew, welcome to the show, buddy.
Thank you. Great to be back with you both.
Mark, I know you're hailing to us from California.
I am.
Fortunately, Denmark did not buy them yet, so they're still an independent state.
I am in a very glamorous roadside motel here in Stockton, California. But I did leave Portland, Oregon yesterday, and I headed down the 5 and through a very gorgeous Mount Shasta region. If any of you have been there, I recommend it. Absolutely beautiful. And I arrived in sunny Stockton last night, and I'll be heading to LA. So I'm just really glad to have you back, Drew. You are, at this point, BFF, right, of the podcast.
That's right.
And we thank you for it, and we love you for it. And let's just get right into this. We've discussed in our first part of this series, part 1 of Lifestages, puppyhood. In our second part 2 of Lifestages, we discussed adulthood, and we found ourselves getting so into it and taking such a deep dive that we had to save part 3 for now and do a part 3 actually. And today we're going to focus on adults and seniors, and I'm particularly excited about seniors since I've just come from taking care of an 18-year-old senior. And I can tell you that it was
dog,
a lot.
that is.
What? Senior dog. Yeah, in Portland, Oregon. And I can tell you that it was a lot of work. And one of the more fascinating parts of that work was that I had Hank with me, my 5-year-old white lab. Everybody knows at this point. And it was amazing to watch him watch me care for this dog. I mean, he was so attuned to what was going on. And I was really proud of Hank. So to get us started, Dr. Randy, we'll start with you on this question. I love this question. Why should our listeners stick around for this episode? What are you going to teach them today, and why is it so important?
Great question. Well, we focus on integrative veterinary medicine at Paws Veterinary Center here in Tucson. My focus for many, many years has been that. And integrative medicine for our adult and senior dogs brings all of these options that we can look at to continue to be proactive, but also to help with ongoing issues that come up, because we will talk about issues that will come up for our especially our senior pets. And there are so many options. And the thing that blows me away, guys, is every day when I'm seeing patients and clients here at my practice, people come in and they have no idea that they can feed something than a prescription diet or a very strong pain medicine. And those are kind of things we're going to talk about. So our listeners should continue listening, watch this podcast, follow us, because this is where you will learn more than you can glean on Google or many other places that I know of.
And you're going to take a deep dive into the senior thing, aren't you, today?
We are.
Yeah, I'm really happy about that. And Drew, we've gotten through puppyhood, we've gone through the terrible twos, and we're going to get through adulthood and seniors today. What are you going to teach us?
Well, I think this is the most exciting age to talk about adulthood, and I think it's the least talked about. And so why I think everybody should stick around is because I'm going to teach you how to have your adult make you look like an awesome pet guardian. And we're going to do that through some really, really, really simple training concepts that everybody can apply to their dogs, to their cats. Once we have that paradigm shift and stop thinking about stopping behavior and correcting behavior and really building behavioral diversity through proactive approach,